Hi everyone. I want to talk about chapter 23, which is non-surgical periodontal therapy. And before I dive right into it, I want you guys to understand what this word, non-surgical periodontal therapy, means. When you hear the word non-surgical, I hope that you're thinking of something that doesn't involve surgery. No surgery. As a hygienist, we don't do surgery for our clients. We debride. We offer oral self-care, right? Education. We offer tobacco cessation. We offer nutritional counseling. Those are all non-surgical periodontal therapy. Those are all treatments. Those are all therapy we offer to our clients so that their oral health can get better. So as long as you're not doing any crazy surgery, periodontist, a gum specialist, they do surgeries. And you will learn about that in the latter half of the course. What we as hygienists do is non-surgical therapy. Non-surgical periodontal therapy means we're not offering surgery, rather we're doing debridement. We're offering education to better their oral health. This is just something I posted when I was teaching, because at that time when I was teaching, a lot of students were upset and were crying. Hygiene school is not easy. I cried so many tears. But I became better. I cried because I failed. Then I learned how I could improve my study skills. So I failed my test, for example. I improved my study skills and I improved on my test results. I failed because I got a 1 out of 4 in my debridement. I thought about how I could better improve myself. I practiced at home. And I got better. The next time I got a 4 out of 4 in debridement. It's okay to cry. Hygiene school is a lot of work. There is blood and sweat that you will put into it. But just learn from the mistakes that you have made so that you can become a better hygienist. So going back to this topic over here, when we look at what a client's role is, like why do we have clients participating in their oral health care, it's important to understand that, for example, if I wanted to offer to my client a specific type of brush to use, okay, so let's say I want to tell my client to use a water pick. Okay, you just learned about water pick. My client is not flossing, and I want to recommend a water pick to the client. You want the client to be involved in that, in making that decision to have a water pick, to use a water pick. So if the client says, no, I don't have the money to purchase a water pick, I'm not going to use it. Okay, work with the client and find another alternative that we can get the client to use. If a client doesn't want to use a water pick, which is ideal, could we encourage them to use floss? Because it's the cheapest alternative. If a client doesn't want to floss every day, could we start with the client flossing maybe once a week and then increase it to twice a week and then thrice a week? Work with the client to come up with a plan. Okay, if we just make all the decisions, it's not going to work. The client's not going to do it. The client has to be involved. The client has to participate. The client has to give their recommendations too of what will work for them and what will not work for them. I've had clients who say, I have no time to floss. And I'm like, well, what about when you're showering? Keep a container of floss in the shower. And while you're shampooing your hair at that time, while the shampoo is sitting, floss. Find ways to incorporate oral hygiene when, you're in the shower or when you're watching TV. I've seen people floss in the car. They use the floss picks and they're flossing in the car while they're stuck in traffic. Do what it takes. Find strategies for your clients so that they can be flossing, so that they can improve their oral hygiene. So work with the client. So this slide over here, it's saying, well, why? Why do we care about them removing all the plaque? Because when we remove their plaque, what happens is that we can eliminate bleeding and inflammation. We know that when there's plaque in their mouth, they're going to bleed. We know that when there's plaque and tartar and calculus in their mouth, their gums are going to be red and inflamed, right? We know that. So we really want to encourage them to brush. We really want to encourage them to floss, to eliminate, to prevent the bleeding and inflammation. Okay. And again, as I said, you want to work together. We can't just make all the decisions. The hygienist cannot make all the decisions. We need to make sure we involve our client in that decision-making process. Okay, it's really important, because if we just demand stuff and, put that on the client that you have to brush, you have to floss every day, it's not going to work. The client's not going to do it. You need to work together to get the client to agree to do it. Figure out what works best for the client. So, I have used a manual toothbrush. I have used a power toothbrush. I love the power toothbrush only because I feel better after using it. My mouth feels a lot cleaner. You could also use a manual toothbrush as well. Studies show that it's more effective to use an electric or power toothbrush. You get more plaque out of it. So if a client has a lot of plaque in their mouth, maybe they're not using a manual toothbrush properly. Maybe you want to recommend an electric toothbrush and see if the client is willing to use the electric toothbrush. Okay. However, studies do show that most people, they just use a manual toothbrush. They're not using an electric toothbrush. And we kind of want to push them in that way because we know electric toothbrush is better. It removes the plaque a lot better. Tongue cleaning. How many of you guys clean your tongue? It's funny I say that because when we look at intraoral examinations in clinic, I want to say 85% of the clients have, or not 95, have white-coated tongue. And the reason why they have that white-coated tongue is because they're not cleaning their tongues. It's so important to clean tongues. Anyone know why? If you said because there's bacteria on the tongue, you're correct. There is bacteria on the tongue. And whenever there's bacteria on the tongue, do you think we'll have good breath or do you think we'll have bad breath? If you said bad breath, if you said halitosis, you would be correct. One of the main reasons why someone has halitosis, why someone has bad breath, is because they're not brushing their tongue. They're not cleaning their tongue, okay? The type of gas that we have on our tongue is called Volatile Sulfur compounds, okay? And it's also known as VSC. That's the acronym. Know that for your test. Those are the gases inside our mouth that's causing the bad breath. So we need to remove this volatile sulfur compounds. We need to get rid of it. And for us to get rid of it, we got to clean our tongue. And so there's lots of tongue cleaning aids that are out there. One of the tongue cleaning aids is this one over here. So toothbrush with a thin head. So here's a picture of it that I put over here. And if you look at the back of the toothbrush, there's like a rough surface over here that you just take on your tongue and you scrub it. Not the most ideal. The best type of tongue scraper is this one here. I like this one. This one is really good. It looks like this, and what you do is you kind of bend it. And if you have it, when you look on, when you bend it on one side, it'll say regular. That's what this says over here. On the opposite side, it'll say soft. And you take this, you bend it, go all the way back on your tongue, and bring it forward, okay? And then when you do that, you'll scrape it off, scrape off all the bacteria. And repeat that motion several times. That's how you use a tongue scraper. There is a video over here that I do encourage you guys to watch. Because when you actually remove everything, you're removing the volatile sulfur compounds, the VSC, the bad stuff in your mouth. We're removing all that bacteria so we can have a better smelling breath. Okay, so here's an example of another tongue scraper that is out there. And so what they're using is they're taking this, they're putting it at the very back, all the way posterior, and then you scrape it forward, rinse off the tongue scraper with water, go back, scrape, rinse off with water, go back, scrape. Now, if you're someone like me, the problem I have is that I have a huge gag reflex. So what would you do? Let's say I'm your client and you recommended tongue scraping to me because my tongue is heavily coated. Maybe you smelt bad breath. And so you think that I would benefit from a tongue scraper. Actually, everyone would benefit from a tongue scraper. So you recommended this to me. And I tell you, well, absolutely not. I'm a gagger. I'm not going to do it. What are some strategies that you could give me to help me or to encourage me to use the tongue scraper? The textbook says that if I was a gagger what I would do is I would still use a tongue scraper, but instead of going all the way back, maybe I won't go as far back. I would just go as far back as I could and scrape it as much as my body would allow before my gag reflex gets worse. So again, I would go as far back as I can and use a tongue scraper. What happens is over time, okay, my body, my gag reflex will eventually get used to the sensation so that eventually I could go further back. And then after a few days, after a few months, maybe it'll get even better and I could go even more further back. So don't give up tongue scraping. Encourage it to your clients. If they have a gag reflex, let them go as far as they can, and then they can go further back and further back if absolutely needed. Okay, so to recap, remember that when you're using a tongue scraper, go all the way back, scrape it forward, and repeat it 2 or 3 times until you don't see any white stuff on your tongue. Okay, so remember the main points of this lecture is that you want to make sure that the client is performing oral self-care, the client is brushing, flossing, tongue cleaning. You want to make sure that the clients play an active role, okay, so they have a say in making those recommendations. And the reason why we recommend tongue cleaning is so that it removes any bacteria on the top of your tongue. Okay, you want to remove everything from the top of your tongue because that's where the halitosis happens, right? If we have bacteria, it's because of halitosis. Okay, that's it for this section.